healthcare decisions to be made between you and your doctor instead of some insurance company. And you want to be able to go to pretty much any doctor or facility in the country to get your healthcare taken care of, or do you want to be limited to local networks and um, PPOs and HMOs that are changing pretty much on a daily basis? Well, if yes, on both of those, you want to be able to go to any doctor, any facility, any hospital in the country, pretty much that takes Medicare, and you want your decisions about your health to be decided by you and your doctor alone, well, Medicare supplement might be the option you are looking for. All right, so we're going to talk about that today. That's going to be today's topic, is the difference between Medicare Supplement Plan G and Plan N, which are the most popular ones out there today. Almost everybody who gets Medicare Supplement gets one of those two. And so we're going to talk about that. That should take about 10 or 15 minutes. And then, as usual, I'm going to open it up and answer all your questions about all things Social Security, retirement, disability, survivor benefits, spouse benefits, Medicare, Medicaid. And so if you don't have a question today, you just want to find out the difference between G and N, then just go ahead and stick around for that. And then after we finish that, we'll see you next time. But make sure you subscribe, because if you don't have a question today, invariably you, your friends, the family, you're going to have maybe a question next week, next month. And so you know where to find us. So make sure you subscribe, and please, everybody, press like so this information goes out to more people, particularly those on TikTok. Unfortunately, I need 10,000 subscribers to do everything right on TikTok. So if you could subscribe, that would be awesome. All right, so let's go ahead and get started. Remember to type in your questions in chat. And once I finish talking about Medicare supplements, I will answer as many questions as I can in about an hour or so. All right, so let's see here. So Medicare supplements, you have a couple of options in terms of your Medicare. So people get Original A and Part B, but which are great, but there's a lot of gaps. There's 6 major gaps. The biggest one is that 20% Part B coinsurance. So if you have a $100,000 bill for a Band-Aid, then you have to come up with $20,000. So 20%. So that's why people get either a Medicare Advantage or a Medicare Supplement plan. The Medicare Advantage plans, those are good for 1 year, and they have pre-authorization. So if the doctor says you need X, Y, or Z, then they have to get permission from insurance companies to do it. And sometimes they deny it or delay it or say, well, try this first, or whatever the case may be. And they also have networks. So they contract with certain doctors or facilities in your area. So if you want to go anywhere else, then you might have to pay out of pocket. So that's why a lot of people are moving and signing up at the beginning when they turn 65 with a Medicare supplement plan. So you don't have the networks, you don't have the pre-authorizations. If the doctor says you need it, Medicare covers it, you're done. Insurance companies can't say anything about it. All right, so let's see here. Let's compare the two. I'm going to go ahead and put a slide up here. Again, sorry, TikTok, you're not able to see this, but so you've got Plan F, but people really can't get Plan F anymore. And even if you could, it's getting more and more expensive, because you could only get it quite a few years ago, and there's less people getting Plan F, and so they're getting older and sicker. So Plan F prices are going up considerably. But it was the one that covered all of the major gaps. But CMS, the Center for Medicare and Medicaid Services, says, okay, hey, people have to have a little bit of skin in the game. So rather than covering everything, they should have to pay a little bit more for their health care, even though they're paying Part B premium and everything. And that's one of the things as well. Even if you pick a Medicare Advantage plan or a Medicare Supplement plan, you still have to continue paying for your Medicare Part B premium. All right, so Plan F pretty much covered everything. The differences between Plan G and Plan N is that Medicare Part B deductible, they both have to pay that, which is not that bad. It's $240. 2024, The Part B deductible is $240. That is a one-time annual deductible. So you pay your $240 the first time you go to the doctor or hospital, whatever the case may be, and you're done. So G covers everything else. G covers that 80%, and it covers the hospital stays and everything that original Part A and Part B don't cover. G covers everything else except for that $240 one-time deductible. Plan N, same, doesn't cover that deductible, but there's a few other things that it doesn't cover. It doesn't cover what's called excess charges. So Part B excess charges, and I don't think I've talked to anybody that's ever been charged an excess charge. An excess charge is pretty much that if a doctor or hospital or clinic throughout the country, they don't accept Medicare rates. So if they don't accept Medicare rates, then what they can do is they can charge up to 15% above and beyond that. But over 90% of doctors and clinics accept Medicare rates. The big ones that don't, that charge these excess charges, as they're called, mostly we found podiatrists and psychiatrists, they charge up to 15%. It could be up to 15, it could be 5%, 10%. And there's some states, there's 8 states out there that limit or completely don't allow excess charges. So excess charges, again, all you have to do is go onto Medicare.gov, check your doctor, your clinic locally, and it'll show you whether that particular doctor charges excess charges. So it's easy to kind of stay away from excess charges. One of the other things that Plan N doesn't cover is they charge kind of a copay for doctor visits and emergency room. It could be up to $20, mostly for diagnostic. So if you go to the doctor for the first time and say, hey, I've got this issue, they can charge you up to $20. I've found most of the time it's about $14. And if you go to the emergency room, they can charge you up to $50. But if you're admitted to the hospital soon after that, they can't charge you the $50 if you immediately go to are admitted into the hospital. So those are the two differences. So why would you pick an N or a G? If you watch any of my other videos on Medicare supplements, you know that I recommend Plan N. And then super, super, super close behind would be a Plan G. And the reason is because I'm cheap. I like to save money. So a Plan N is cheaper. The monthly premium is cheaper than Plan G. And everybody pretty much in the industry out there that's looking at this also recognize that Plan G, the prices looks like they're going to continue to be higher price increases on Plan G going forward than Plan N. So that's why, again, the monthly rates, premiums for Plan N are cheaper now generally across the country, and they look to be cheaper going forward. So it really depends on your particular situation on which one is the best one for you. If you are kicking around, if you're about to be signed up for Medicare, you're turning 65, or you're going to stop working and stop receiving health insurance from work and sign up for Part B, then you need to decide what you're going to do, Medicare Advantage plan or Medicare Supplement plan. And it really depends on your particular situation. So for some people, Medicare Advantage is the way to go, budget-wise. Others, a lot of the Medicare Advantage plans have zero premium per month, but it's kind of a pay-as-you-go. You have to pay, a little bit of this here, a little bit there, a little bit of this, and you got the pre-authorizations. So if you're able to budget a Medicare supplement into your monthly budget, and you don't want to have to deal with all that insurance company stuff, then Medicare supplement is the way to go. So those are the two decisions you have to make. You have to decide, number one, Advantage or a supplement. And if you choose supplement, then you have to decide G or N. So again, it's a completely individual decision based on your needs, your health, your budget, and everything. If you need help with any of that, make sure you give us a call. And I have a network of partners throughout the country that can help you with all things Medicare. and give you all your options. And obviously, that is a completely free service. All right, so I think we went through that pretty quickly. 10 minutes. There's a lot more details on that. I can go on a deeper dive later if you wish, but people are always interested in me answering all the questions. So if you're done with the Medicare supplement and that's all the information you want, we'll see you next time. Again, make sure you subscribe, and that way you can find us in the future when you do need help with anything retirement, disability, Medicare. And let's go ahead and start answering all your questions. All right, so we got some questions already. Let's see here. Dutch. How many doctors charge the upcharge? Last I've seen, it changes on a regular basis. You're talking about the excess charges. Yeah, it's mostly again podiatrists, psychiatrists. That's what I found to be the predominant ones, and 5% or something. And some states don't even allow excess charges. So and again, you can easily avoid doing the excess charge again because you don't have networks with Medicare supplements. You can go to any doctor in the country that accepts Medicare. You don't have to ask them, okay, do you accept this plan or that plan? What happens is you go to the doctor and say, you accept Medicare. Okay, beautiful. And the Medicare supplement plan you have, whichever insurance company you pick, it is, private insurance company. But if it's, let's say, insurance company XYZ Medicare supplement plan, plan G, plan N, whatever, then you don't have to ask that doctor or clinic, do you take XYZ Medicare supplement plan? You don't have to, it has nothing to do. Do you take Medicare? That's the only question you have to. You take Medicare? Okay, cool. Do you charge excess charges? No? Okay, good. You go to the doctor and the doctor says, okay, you need X, Y, or Z, and it's covered by Medicare, and you're done. You don't need to ask the insurance company. How it works is the doctor bills Medicare. Medicare pays, for instance, their 80%, and then they essentially kind of bill that company to pay the other 20%. And that company has zero say. Once you sign up for the Medicare supplement plan for whatever company, then you pretty much never have to deal with them again because you don't need authorizations or networks or anything like that. So it's a beautiful system. Let's see. No more tears. Does Medicare accept chiropractic care? Yes. Watch my video I just did. Was it last week? Was it 11 surprising things covered by Medicare? But yeah, it's a specific type of issue with your back. So it's not just general, kind of upkeep chiropractor. It has to be a specific issue. So make sure you watch my video on that one, and I give you the details on exactly what type of chiropractic care is covered. Let's see here. Kim, good evening, Dr. Weir. So I'm going to need Medicare Plan B or Part B. Plan N, I'm going with that one. I like it. And Plan D, after paying all of them, will I have any money left to live on, or I would just have to retire to pay? Yeah, so that's the budget issue I was talking about. And again, budget issue. Um, if 100% for sure that you're gonna live the next 50 years, and you're pretty much never gonna be sick or anything, then I would highly recommend a Medicare Advantage plan. Get a zero premium Medicare Advantage plan. That way, if you ever get a cold or something like that, you can go see the doctor. But yeah, but you're gonna live the next 50 years and not gonna really get sick. And so zero premium, that's the way to go. If you're not 100% sure, and you just might get sick or get injured or whatever the case may be, and you don't want to have to deal with the doctors, networks and pre-authorizations, and with Medicare Advantage, even though a lot of them are zero premium per month, they charge for hospital, and they charge for doctor, and they charge for this, and they charge for that. And if you have a great plan that covers all that stuff this year, the plans are only good for 1 year. So that might be good this year, but next year, what about next year? Or the year after, or the year after, or 10 years from now? And the thing about Medicare supplements is, you have that golden opportunity when you turn 65 to sign up for any Medicare supplement plan, no health underwriting. If you're new to Medicare Part B, even if you're, 67, 70 years old and you just signed up for Part B because you had health insurance, then you're in that golden opportunity to pretty much pick any plan. But after that, if you have a Medicare Advantage plan for 10 years and you'll say, well, I just switched to Medicare Supplement in 10 years, I'll save, the premium until then. It depends, if you're healthy at that time, then sure, you can switch to a Medicare Supplement plan. But if you're no longer healthy, then you might not be able to switch because they are allowed to ask you a bunch of questions about your health. So it's a health underwriting. And if it turns out you're not healthy enough, then they can deny you, and then you're stuck on the Medicare Advantage. So, if you know the future, then that's one thing. But if not, that is an insurance. That's why you get car insurance, because you don't know the future. Yeah. So, yeah, health insurance. So, and yes, with the Medicare supplement, it only covers what Part A and Part B doesn't cover. You'll also need a Part D plan, the prescription drug plan, and they don't have all the extras like a Medicare Advantage plan. Some of those have vision, dental, hearing, and stuff, which I believe personally, I wish it would change, that Medicare original Part A and Part B should cover things like vision, dental, and hearing. I mean, how healthy can you be if you don't have any, you can't eat, or you can't hear, you can't see? So it took us decades to get prescription drugs added to original Medicare. So we're going to have to work harder to get those three things added to Medicare, but they're not part of Medicare supplements. So you'll need Part A, Part B, and then get a Medicare supplement, G or N, whichever one's good for you. You also need the Part D. There's a Part D. There are some plans out there that under $5, under $10 for a Part D prescription drug for the premium part. And then if you want vision or dental, dental vision, it really depends on your particular situation. I'm not super big on dental or vision. Sometimes you get a dentist that can help you out, but again, all individual decisions. So there's that. All right, Kim Jones. Let's see here. When retired, is it best to just go with Medicaid and Medicare Advantage to avoid costly premiums? So Medicaid is the state welfare program. You can have Medicaid if you have limited income and resources, and again, that's a welfare-based program. But you're probably talking about Medicare. Yeah. If you don't want the monthly premiums, Medicare and a Medicare Advantage. But again, it's a pay-as-you-go system. Even though you don't have the premiums, you just might have all kinds of cost sharing, where you have to pay X amount to go see a specialist. You have to pay X amount to go see your primary care doctor. You have to pay this much for a test, an X-ray, a MRI, a CAT scan, however many hundreds of dollars every day when you get in the hospital. So it's a pay-as-you-go system. Again, if you know for sure that you're never going to be sick and never use any of that, then 100% Medicare Advantage is the way to go, zero premiums. But again, it's individual decision and you looking into your crystal ball for the future. Yeah. Does any Medicare plan pay anything towards nursing home care, and how long? Yes, nursing home care, original Medicare doesn't. I'm gonna have to do a deep dive on nursing home. There's skilled nursing facilities or skilled facilities after you come out of the hospital and surgery that it covers. That's why a lot of people, get Medicaid. Medicaid, the state programs, they cover nursing home care. But the problem is, if you're low income, you can get Medicaid, and therefore, you can get your nursing home care taken care of. But if you're middle class and you have some, particularly like a house, one of the issues out there that people have a house and but they don't, all they have is a social security check, and they've already depleted all their savings because of the nursing home care, and so they go ahead and apply for Medicaid because they've run out of savings and all they have is a social security check and they are eligible for Medicaid. Beautiful, awesome. But when they pass their house, the state can come after their house. So, you're looking to give your house to your kids or something, and but you go into a nursing home and the state pays for your nursing care, and then when you pass, your kids don't get the house. The state gives the house and they sell it to pay for your nursing home care bills. There's a way around that. What people are doing is they're getting an irrevocable trust. An irrevocable trust is basically that you put the house and everything in a trust, but there's a 5-year look back. So, which means you have to do that 5 years before you go into a nursing home. Because if you do it 2 years ago, they can still look back and grab your house, but it has to be 5 years. So that's one thing you have to prepare for immediately, if not sooner. So, yeah, I'll do a deeper dive, but that's kind of the general gist of all of that. So since I am working till 66, can I apply for all of that next year? Right. Yeah, if you're working, just with, the same with original Medicare, if you're working and you have health insurance from work and you're happy with it and your employer has 20 or more employees, um, again, your current work or your spouse's current work, then you don't have to sign up for Part A or Part B or Medicare Supplements or Part D or anything like that. But when you stop working and you stop receiving health insurance from current work, yours or your spouse's, then you have 8 months, legally 8 months to sign up for Medicare plan, and you won't be charged any penalties or anything. Legally, you have 8 months, but you know what happens when you don't have health insurance for 8 months. So the best thing is about a month or two before you're going to lose your health insurance from work, then sign up for Medicare Part A and Part B at that time. So one ends the end of the month, and Medicare and everything starts the next day. So that way you're completely protected. April, thank you for the informative information. You're welcome. You're welcome. Kim, I agree. They should have vision and dental since a large majority wear glasses as they age. Exactly. Yeah. So that's our job. So contact everybody. We get politicians that we deserve. That we work for. So go out there and we added Part D, the prescription drug coverage. Original Medicare started in 1965, and several decades later we thought, well, maybe people need drugs too. So it took us several decades, so we really got to start. Hopefully it doesn't take us several more decades to add vision and dental and everything like that. So hello, Dr. Weir. Which one is better, Plan G or N, in your opinion? I personally like N. Again, because I'm cheap, and I kind of see the writing on the wall that Plan N, the prices are going to go up less in the future than Plan G. That's because it just Plan F used to be the guaranteed issue. It was easier to get into. F is, you can't get into it anymore, pretty much. But Plan G is now what's called the guaranteed issue. So more people can get into it, and therefore the sicker people and older people and stuff. So that's why Plan N is, if you're able to get a Plan N, I would 100% do it. A lot of people contact us and they have Plan G and they're still healthy. So they want to get while the getting's good and switch to Plan N. So if you have Plan G, give us a call, call the number, email me. And like I said, I've got a network of partners throughout the country that can, whatever state you're in, just tell me, email me or give me a call, and say, my name is this, I live in this state, here's my phone number, and here's what I'm looking for, and I'll find someone in your area that will take care of you and treat you right and give you all your options. That's 100% a free service. And as I always say, full disclosure, if you end up enrolling with whatever those brokers, they support our channel. And there's a difference between agents and brokers. So if you got like a captive agent, which is they work for a particular company, an insurance company. So if you call them up, guess what, option you're going to get, it's the old Henry Ford, you can have any color car you want as long as it's black. So I only work with brokers. So brokers don't work for the insurance companies. They sell those insurance companies, they enroll people, but they work for you. So they look at your area and your, conditions and doctors or whatever, and they give you all your options. They look at all the dozens and dozens and dozens of plans in your area, and then they say, here's, based on all your criteria, what you need, and here is my recommendations, and which, if you like them, then it's a beautiful thing. So, all right. Luke, Dr. Weir, if you have an elderly parent on SSI, if I move in with her will my Social Security income affect her SSI and Medicare, Medicaid benefits? Possibly, possibly. So, Social Security is changing the SSI rules. Finally, they just changed it. It's called ISM. There's an acronym for everything in Social Security. It's in-kind support and maintenance. And traditionally, up to recently, if you were helping someone with food, they would count that against you in SSI. And they said, well, that's stupid, charity and family and stuff. They shouldn't count that. So they stopped kind of counting that. They're also doing the same thing for rent, but that won't take effect till September. Some states still don't count that. But basically, if you are giving, your elderly parent kind of like a subsidy, you're helping pay the rent, or they're not paying the full rent, and you're helping with it, they are counting that completely different going forward, starting in September. So that is a beautiful, beautiful thing. So I would make sure anytime an SSI recipient has any type of living arrangement change, they have to notify Social Security, and that will be adjusted. But you're basically kind of, you're living with them, and you're providing them help, and they kind of owe you, so they're kind of in debt. And so yeah, there's many ways that maybe I shouldn't say anymore, but that is how some arrangements work. If you're getting money from some place, but it's not a loan, or it's not a gift, it's a loan, because eventually you have to pay that person back. You've got a brother that's paying, helping you pay your rent for $300, but once you get some money in the future, you need to pay that money back, then therefore it's a debt. So SSI kind of looks at that differently. So in your particular case, yeah, but if your parent is kicked off SSI, then they also might lose their Medicaid, not Medicare. Medicare doesn't matter. Medicare is good. It's just the SSI and Medicaid, because those are, welfare-based, needs-based programs based on, and, income and resources. All right, let's see here. What happens if I get on Medicare and then get a part-time job that offers insurance? Do they stay on Medicare or switch to the group insurance? Yeah. So if you get on Medicare, some companies, it really depends, for whatever company you're going to work for, if they have 20 or more employees, and, I check with HR, you can get off Medicare, if you have other health insurance. But sometimes, it's kind of too much of a nightmare, and you can, yeah, the insurance company that your new job has, they might say, okay, well, we'll have Medicare as the first payer, and we'll have our insurance company as a backup, as a secondary payer. So there's just a lot of different variables depending. Yeah, insurance, all of it is just a nightmare. Lola, how I know which plan I have? Yeah. So you have, I'm sure you, sounds like you probably have a Medicare Part A and Part B, original Medicare. Um, yeah. How do you know which plan you have? Yeah, you should, whether you have a Medicare Advantage plan, Medicare supplements, yeah, whenever you go to your doctors, you probably hand them some type of card. And so check out that card and ask them, whether you're a G or an N or whatever the case may be, or whether you have a Medicare Advantage. If you have to get permission for all that kind of stuff, then that means you have a Medicare Advantage. If you have a network of doctors that you can go to and you have to call them up all the time and say, "Are you a network?" And those change, they change all the time. One, continuously check, because I've had people contact and put in the comments that, yeah, I went to this doctor last month and everything was good, but this month I went there and now they don't accept my plan anymore because, yeah, it changes on a regular basis. That's another reason if you can afford it, Medicare, Medicare supplements. And that's the problem. There's a lot of people on YouTube and TikTok that, talk bad about Medicare Advantage. And I wish everybody could get a Medicare supplement plan, because so they don't have to deal with all the, insurance stuff. But some people just can't afford it. And that's just the reality. I wish it wasn't so. I wish everybody could, if everybody got a Medicare supplement, then the prices would go down. But, that's going to take a while. And people just can't afford that monthly premium until then. So they go with the zero premium, Medicare Advantage plan, which is fine if that's what you can get. But it takes a little bit extra effort. You have to check every year because those plans are only good for 1 year. And so you have to check every year and make sure your doctors are still in network next year and your prescriptions are still at a good price. And those plans, even though you have XYZ Medicare Advantage company, you think, oh, I like this company and they're good. My doctors are covered. Well, that company probably has 5, 6, 7 plans in your area. So if you've had that plan for a while, that might be the older plan. That same company with the same doctors and everything might have a better plan because they're trying to entice new people to join, and a lot of cost savings. And your plan is a year or 2 years old to 3 years old, and they might have changed a whole bunch of stuff that you don't see immediately until you need it. You can see the comments, on a bunch of my YouTube videos that, yeah, I had to go to the hospital and they charged me $200 a night. But when I signed up for this plan, it was zero. That they didn't charge me for a hospital. Well, those plans change every year. Medicare Advantage plans are only good for 1 year, period. There's people say all the time, I've been on this plan for 3 years. No, you've been on this plan for, was April? You've been on this plan for 4 months. The plan you had last year is gone. This is a brand new plan. It might have some of the things that last year's plan, or maybe all of them, but quite often the stuff underneath is kind of changed. So, and you don't find out until you find out, and then it's a surprise. So, if you have a Medicare Advantage plan, you just needs a little bit more effort. And again, call us up, email us, and I can find someone to make sure you're doing the right thing and getting all the benefits. Because the zero premium plans, you know, Medicare, the Center for Medicare and Medicaid Services, um, doesn't allow agents or brokers to say these are free, because, which is good. I like this. I like this theory. I like this policy, because they're not free. Your Medicare Advantage plan might be zero premium, and you say, "Well, it's free. It's the same thing, free." No, 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 no. You've just you've already paid for that. Zero premium now, but you paid for that plan for decades. When you paid your FICA taxes, 1.45% of those FICA taxes that you paid, and your employer paid 1.45, you paid for that for decades. And that money is sitting in Washington or Fort Knox or chock full of nuts can out in the backyard, wherever it is. And then when you sign up for Medicare Advantage XYZ company takes their can and goes to Washington, D.C. and say, hey, we just signed up Ellen here. give us give us her money that she paid into, FICA all those decades. So, and then the government gives a certain amount every month. There's a complex formula. Um, so they give that company your money to take care of your health care. So it's not free, it's zero premium. The reason it's not free is because you already paid for it. So if you already paid for something, get it. If you go out and buy a car, put down, $20,000 for a car and they don't deliver it, you're not going to be happy. Well, you put down more than $20,000 for your health care, use it. So make sure you watch my video on that about, making sure you get everything. I just did one about a week ago on how to get your money back from Medicare. And yeah, obviously they're not going to give you all your money back, but they're going to give you money back in terms of the services, preventive and all of that. So watch that video on how to get your money back from Medicare and get your money back from Medicare, from your Medicare Advantage plan, Medicare Supplement, whatever the case may be. All right, let me answer some TikTok questions here. Sorry, TikTok, ignoring you here. You don't own the house anymore if you put it in that kind of trust. Yeah, it's a irrevocable trust, and you kind of put it in family name or something like that. So yeah, and that's how you kind of protect it from the state taking it from you. So if you sign up for Medicare Part B, can you drop it if you don't like it? Yeah, I mean, yeah, with Medicare, yeah, you don't have to take it, but you know, I used to say I was an old Marine Corps sergeant. You don't have to do anything in life, but the repercussions of not doing some things are, yeah, strict. You don't have to sign up for Part B. You can drop it, absolutely. But if you decide to sign up for it later, then you will be penalized. If you don't sign up for Part B when you're supposed to, you will be charged 10% for every 12 months you didn't sign up. And Part D as well, the drug plan. If you don't sign up for the drug plan, then you will be penalized for the rest of your life. And this is important. I want people to understand this. That there's so many people out there doing the wrong. That's why I decided to go ahead and put together a network partners of people I know and trust that are going to take care of you and give you the correct information. I was tired of people giving incorrect information. So people say, "Oh, okay, I'm going to go ahead and sign up for Part B and a Medicare supplement, but I'm not going to do Part D because I don't need drugs. I don't take drugs. I'm just going to sign up for it." And there's Medicare agents, brokers out there that just let that slide because they don't make any money on the Part D plan, and they don't want to fight you and say, "Oh, you really need to do it." So they just kind of let it ride. And then 2 or 3 or 4 years later, when you do sign up for Part D because you need some type of drug, guess what? You're going to be penalized. Basically, 1%. It's a complex formula they use, but yeah, 20, 30, 40% of the premium you would have to pay extra for the rest of your life. So if you have a Medicare supplement and you don't have a Part D plan, then you gotta get one immediately, because the sooner you get it, you'll have to pay penalties for the rest of your life. But if you get it as quickly as you can, then you're gonna save yourself even more penalties. Again, even if, but I don't take drugs. Well, doesn't matter. You still have to sign up for it. Insurance is insurance. Auto insurance. I don't intend on having a car accident this month. Knock on wood. But you have to have it. And the good thing is there's some plans out there, Part D plans, that are super, super inexpensive in terms of monthly premiums, under $10, under $5. So yeah. So even if you don't take drugs, please, you need the Part D, or you're going to get penalized. Yes, the penalties are permanent. You pay for them forever. Was accepted for SSDI, but it takes a while. Can I get SS for a year and pay it back when SSDI kicks in? Can you get SS? So I think maybe if that would be a no to start with, but If you are 62, but if you're already have been accepted for SSDI and you're already approved, then your case should be you should be getting your money here pretty soon. It shouldn't take a year to get your money if you're already approved for disability. But um, if the case is you're applying for disability, and let's say you're 62, 63, 64 years old, and you know that disability takes, forever to get approved, 5, 6, 7, 9 months, if you're lucky, and during that time you need money, then you can file for retirement at the same time. It's called a rib dib, internal, you know, terminology. You're filing for retirement and disability at the same time. So while you're waiting for your disability benefits to be approved, then you can at least start getting your retirement benefits. But caution on that: if you are eventually approved for disability, because you've taken your retirement early, your disability is going to be reduced a little bit. But hey, if you need the money, then you need the money. All right, let's see. Got lots of questions. All right. And please, everybody press like and subscribe and all that kind of stuff, and so that goes out to more people. Um, okay. How long before my 70th birthday do I need to register for Social Security benefits? Yeah, if you have been waiting to collect your Social Security benefits until 70, so you can get those max delayed retirement credits, awesome. Then yeah, no, a couple of months, couple 3 months is more than enough time. So yeah, if I don't know if you've already have Medicare, if you've already filed for Medicare, then you're already in the system and the claims path and everything. So it's very, very easy to get your monthly benefits started. So you're tapped out and your delayed retirement credits the month you turn 70. So you want to start your benefits the month you turn 70. But yeah, the claim specialist at Social Security will give you the specific numbers of that. Chris, I signed up for Social Security and Medicare in February, turning 65 in May, starting benefits in June. I still have not got Medicare welcome packet. Um, let's see, signed up in February and turning 65 in May. Yeah, you should have already received it. Benefits in June. Yeah, you should have already received it. Did you? I wonder if you already got the letter from Social Security that your claim has been approved and all that, or um, yeah, or they're sitting on it, or maybe it was a new employee that took it, and new employees have to go through 100% review to make sure everything is correct, and they haven't adjudicated it yet because it's still under review. But yeah, something doesn't. Yeah, you should have already received it, because your May is turning 65, and you need that to sign up for everything else. You need that Medicare number to get everything else. So I would reach out to the office and kind of light a fire under them, not a literal fire, but yeah, and say, hey, what's going on? I need my Medicare card. And maybe they just haven't printed it out and gotten it to you. And they can at least give you your Medicare MBI, your Medicare beneficiary number. So they might be able to just give you that number. It's no longer your Social Security number. In the old days, your Medicare number was your Social Security number, but they don't do that anymore. So yeah, call them up and say, hey, what's going on? What's my money? And by the way, do I have a Medicare beneficiary number yet? And they might be able to just get it on the phone, and that way you can go ahead and enroll in an Advantage or Supplement or Part D, or call us and we can help you out. Liberty, the rate of increase on Plan N is less over time. Yes, that's what nobody knows the future, but that's what everybody believes, and I believe that too. I've been on disability since I was like 38. I'm 70 now. Am I allowed to make any money? Yeah, you are no longer on disability. Your disability stopped years ago. You are now on retirement. Everybody is switched to regular retirement once they hit their full retirement age. There's nobody on the country on disability at 70 years old. everybody's on has already been switched over to retirement benefits, which is, you know, the benefit, the amount you get from Social Security is exactly the same, and your Medicare continues if you have that, and your pay date's the same, and all that kind of good stuff. The only thing different is, you know, you don't have to jump through all the disability hoops, and you don't have to worry about working and continuing disability reviews and all that other garbage. You're now free to do whatever you want. Nobody cares. Well, I mean, Social Security doesn't care. People care, but Social Security doesn't care anymore. So it's a beautiful thing. Let's see. I could use some feedback about Medicare. I'm on disability and money different state. How can I transfer my medical? Okay, I mean, you wrote it up again here. Let's see. I'm on disability Medicare, but moved to a different state. How do I get my supplement? Oh, okay, okay, there we go. Yeah, if you're on disability and Medicare, but if you're on Medicare, it doesn't matter. Medicare is a national program. Um, doesn't matter. Um, Obviously, call Social Security and make sure your address is updated. And when you update your address with Social Security, then the system automatically notifies Medicare that you're in the new system. However, if you have a Medicare, how do I get my supplement? Okay, so if you actually, if your supplement is a Medicare supplement, then yeah, reach out to us and we can find another plan in your particular area. Or, you know, if you want to stay with the same exact company, which if you're crossing states, it's might be a good idea to shop around again. So for Medicare, just call Social Security, change the address. For Medicare supplement, you know, whoever signed you up, maybe you reach out to them if they're, you know, licensed in the new state you're in, or you can give us a call and we can see what we can do. What's with the sign up? I have Medicare A and B. I never signed up for anything. What's with the sign up Medicare? Yeah, if you are receiving monthly Social Security benefits, whether it's disability or, you know, retirement, survivor, spouse, whatever the case may be, um, if you're receiving disability, they automatically sign you up 24 months after you're on disability for 24 months. They sign you up automatically. If you're on retirement, survivor, spouse, and you hit 65 years old, they automatically send you your packet. They automatically send you the packet, but you can refuse it at that time. So if you're 65 and usually about, you know, 3 months before you turn 65, you'll receive the packet in the mail. And if you have health insurance from work and it has more than 20 employees and you're happy with it, and it doesn't cost you an arm, a leg, and yada yada yada, then you can just refuse it. You can refuse Part A and Part B. A lot of people just take Part A since it's, you know, free, um, and I can say free on Part A because it's not Medicare Advantage. But yeah, it doesn't cost you anything for Part A. But if you have a health savings account, you shouldn't sign up for Part A because you can no longer contribute to a health savings account. But for B, yeah, if you already have health insurance from work, your work or your spouse's work, then you don't have to sign up for Part B. But it sounds like maybe they already did a while ago, and yeah. So, but yeah, if you have health insurance, then you can go ahead and refuse it. And in the packet, it'll show you exactly how to refuse it. You know, return the card or whatever. Let's see. Hi, Dr. Ed. I have a question about CDR. I have read that when you turn 50, your reviews get automatically changed from every 3 years to every 5 to 7 years. Is this true? Thank you. No, I haven't heard that. I'm going to do one on CDRs this week, and too many people are kind of stressed out about CDRs, and I think that's Social Security's fault. Obviously, Social Security's fault. But yeah, stay tuned, and I'm going to put together a little thing on CDRs, about 10 or 15 minutes, um, with my strategy on CDRs. So make sure you join me on that one. But no, I've once your claim is adjudicated, you're approved for disability. The DDS, the state agency that does that, they assign you a rotation date every year, 3 years, 5 years, 7 years, whatever the case may be, and then that's how it's determined. I haven't heard them changing it or anything like that. But yeah, make sure you join me um, this week. And if you can't join me during the live, obviously, just like this, after I do the live, I post it, and so you can watch the playback. So, in fact, I've seen where they send people Medicare cards when approaching 65. Can one opt out of them taking premiums without penalties moving forward? Yep, I think I just addressed that one. So perfect, perfect. Everybody's on the same page. I like it. Yeah, so you can. It tells you in there. Just you can refuse it. Um, Dr. Weir, can one change a Part D plan, or is it hard because of pre-existing? I'm diabetic with concerns of cost of the medication. No. Well, yeah, no. It is not hard. It is recommended to change your prescription to reevaluate your prescription drug plan every year. So just like your Medicare Advantage plan, to make sure you're in the best plan, saving as much money, looking at the details, making sure there's no surprises. But Part D, same thing as Medicare Advantage. Part D plans are only good for 1 year. So every year, you can change those. And because, the formularies change and the prices change and yada, yada, yada. So you wouldn't be able to change now unless you move or something like that. So, but when the annual enrollment period comes in October, November, December, then, reach out to us and, or, whoever signed you up and say, hey, I want to see whether there is another Part D plan that's going to save me money. And there's no, pre-existing conditions or anything like that. They can't deny you. With a Part D plan, they can't deny you. So yeah, so um, you know, the American system is all right. I'm not going to get started. For denial for pre-existing conditions, that has been, historical in America. It's always existed, but that changed, when the Affordable Care Act, Marketplace Insurance, Obamacare, it's all the same thing. So for people under 65 that want health insurance, they can't deny you anymore for pre-existing conditions, which is a beautiful thing. Medicare Part A and Part B can't deny you for any pre-existing conditions. Medicare Advantage plans can't deny you for any pre-existing conditions. Medicare Part D, the drug plan, can't deny you for any pre-existing conditions. The Medicare Supplement Plans can. Those are the only ones. Medicare Supplements, also called MediGap, the G or the N. So again, they can't deny you if if you have an enrollment period. That is, you're turning 65, they can't deny you. If you're 70 years old, but you just signed up for Part B, they can't deny you. So there's other small little situations as well. But yeah, if you're outside of one of those enrollment periods, and if you're 70 years old and say, oh, I'm tired of these networks and pre-authorizations, I want to get a Medicare supplement, then they can deny you. It's go through health underwriting, and if they determine that you're not a good risk, then they can deny you. Yeah. So if somebody never worked, can they get Medicare? Um, Not on your own record. So you actually had to pay into Medicare for the 10 years, 40 quarters. But if you never worked, but you were married, you can get it from a spouse or, ex-spouse or surviving spouse or deceased spouse or whatever that, yeah. So either one of those, you can get it from, even if you haven't worked yourself. Dutch, thank you for all honesty. Yeah, you're welcome. You're welcome. And let me tell you, let me give you, let me share how the sausage is made for Medicare plans. So we're talking Medicare Supplement and Medicare Advantage. Agents, brokers, Medicare agents, people that enroll people in Medicare plans, they make more money generally with Medicare Advantage plans. Everybody, insurance company make more money. The agents make more money when they enroll you for Medicare Advantage plans. So that's why they recommend Medicare Advantage, because it's good for them. You're like, okay, Ed keeps saying Medicare supplements are best, and that's because Ed makes and his partners make more money selling Medicare supplements because they cost, there's a monthly premium, the monthly premium for a G or an N is anywhere from like 80 to 100, 120. New York is like $200 or $300. Yeah. So people say, oh, yeah, that's why he likes Medicare supplements because, they cost more. And so therefore they probably make money and more money and stuff like that. No, it's the exact opposite. It's weird. Everybody makes more money enrolling you in a zero premium plan. Go figure. Yeah, because there's not a lot of money in the Medicare supplement ones. Because again, the insurance companies can't control your health care. If Medicare covers it, then the insurance companies have to pay out. They have zero say so whatsoever. Medicare Advantage plan, they can control you and restrict you and all this other kind of stuff. And the government is coming down on some of these, these Medicare Advantage plans. You probably see in the news that they've been using algorithms to deny people. And so yeah, everybody makes more money when you enroll in a Medicare Advantage plan. So that's the reality of how the sausage is made. So Cheryl, so it's interesting because I recommend I recommend the plan that everybody makes less money. So if someone signs you up for a plan N, that's the least amount of money the person enrolling you, and it's the same exact price. And you say, well, I'll just go directly to the company. It's the same exact price. It's just now that the billionaire CEO will get that commission, you know that money, and you'll have to do everything yourself. But if you go to a Medicare agent or a broker, it's free to you. The insurance company pays them directly, and that money is going to go somewhere. If you go directly to the insurance company, it's the exact same price. But if you do N, if you sign up for N, then that person gets the least amount of commission. If you do G, a little bit more because the premium's a little bit more. And if you do Medicare Advantage, they get a lot more. So yeah, so I recommend the one that I think is the best, that I would take, and everybody makes less money. So, but too bad for them. It's good for you, so it's good for everybody. Cheryl, single individual sales home profit made, but not capital gains, not earned income. Does Part B of Medicare increase because of IRMA? Yes, yes. Unfortunately, I worked at Social Security and I've done these IRMA things. And IRMA is basically, um, Congress decided a few years ago, in order to, help save Medicare, they charge an extra premium for high wage earners. So if you're a high wage earner, if you're single, it's over 103,000, married over 206,000, then you're paying an extra. You're not paying the 174 and change. You're paying more. And they determined that based on your income from 2 years ago. And unfortunately, home sales, Congress didn't carve that out. They still consider that income. So if you sold your house and made a couple 100,000, then unfortunately you're going to have to pay a extra premium for 1 year, just for 1 year. You don't have to pay it next year. It's just that 1 year. However, if you sold your house and you got $50,000 and you also worked that year and you made, $70,000, putting that together, that's high, but you've since stopped working. So that is what's called a life-changing event. So if that's the case, then you file an SSA 44, and it's a life-changing event for the IRMA. So you basically tell Social Security that, yeah, I sold my house. I know you're going to count that. You're not, people appeal that all the time, and it's denied. 100% it's denied. But if you're over because of the house and your work, then you say, hey, I've got a life-changing event. I have since stopped working. Then depends on the numbers and everything. They just might, negate that extra premium. And if you've already paid it for 1 or 2 or 3, 4 months, they'll pay you that money back. So it's a beautiful thing. Eva, does Social Security get taxed in New York and Florida? Oh, yeah, I don't know. I don't do taxes. My sister lives in Florida. Gosh. Yeah, we don't talk about taxes. Family gatherings, yeah. So, I don't think it's taxed in Florida. I grew up in Florida. I'm not sure why I don't know about Florida, but anyway, yeah, I'm not sure. So I would talk to your tax person and stuff. So yeah. Jimbo, thanks again for the info. Over 70 people watching, but only 40 thumbs up. Just hit that button. It's free. I always got the people like Jimbo is always hooking me up there. I'm not yellow today. I've got a little bit better. Well, yeah. I'm new to this whole YouTube stuff. I know Social Security, Medicare, and Medicaid, but YouTube stuff is it's still challenging. I'm getting a little bit better every day. But yes, please. I just every time y'all press like, this goes out to more people, and you wouldn't believe how many people y'all are helping. Um, yeah, people are finding money every single day because y'all press the like and share and put it on your Facebook. So please keep doing that. Thank you for sharing your knowledge. You're welcome. You're welcome. Cynthia, I appreciate all this information. It's very confusing. Yeah. Um, I would so much love to go back into retirement. I teach at the university. I've taught for 20 years. I've got final exams coming up soon. So I wouldn't mind, just doing that full time and just kind of relaxing. But so many people need help, and I've got the information. So that's why I'm here. But if Social Security and Medicare made everything easier, then y'all wouldn't need me. And yeah, but it's not. It's just too confusing, and people are worrying whether they're getting the correct benefits. And yeah, so I'll be here for the next 20 years. Luckily, hopefully. How do you feel about state federal workers having their insurance and Medicare? Does this act like a MediGap plan? Um, yeah, they're all different. There's a lot of um, companies, state agencies, city governments that are doing kind of supplements. They're also doing Medicare Advantage because they're getting together with these big Medicare insurance companies. And yeah, the old pensions, like your parents and grandparents used to have, those are pretty much gone. And the whole health care forever, those are kind of going away. The retiree plans, in order to save money, are just kind of giving people Medicare Advantage plans, and one day they have networks and pre-authorizations. And so it really depends on the situation. Some Medicare Advantage plans are very, very good when they're retiree plans, because um, everything is covered. What's not covered in the Medicare Advantage plan, the retiree plan covers. So like if there's $200 co-insurance every day for every day you're in the hospital, the retiree plan pays that. But you still have the pre-authorizations and the networks and stuff like that. So Part A isn't any more free than Medicare Advantage. Both have, yeah. I'm talking about the premium. Yeah, it's a premium. The premium is free for the most part. And as I always say on my videos, there's exceptions, the exceptions, exceptions. If you paid your FICA tax for at least 10 years, 40 quarters, then it's premium free Part A. Yeah, there are, some gaps there. You got $1,600 or so on deductibles every time you go into the doctor's. What is 1632 this year? So if you go to the hospital, you have to pay the first $1,632, and that's not one time a year. That's could be 3, 4, 5, 6 times a year if you go into the hospital. It depends how long the separation is between one hospital visit and the other. So yes, Kathleen, yes, it's not free. The premium, unlike Part B, $174.70. Part A is free, unless you didn't pay into FICA for 10 years. Then you have to pay for Part Part A. Let's face this. Asks IEDS, if married. So IEDS is independently entitled divorced spouse. If married since the 80s, then separated after 12 years. Okay. Divorced after 12 years. How does wife proceed if neither party filed? Oh, for divorced. Should she get divorced now and file once she gets the decree? Yeah, if so, you can't do independently entitled divorced spouse because you're not divorced. So you are still technically married, it sounds like. And because you're still technically married, he has to file, he, right? See the picture. Yeah, it looks like female. Okay. He has to file for benefits. And if he files for Social Security disability, then you can file for spouse benefits on his record. You obviously have to file for your own first. But if he hasn't filed, and he's 62 years old, you need to be divorced from that person. And then you can do the independently entitled divorced spouse benefits. And to keep everybody in the loop on what that is basically if you're divorced from someone, um, even if they haven't filed for benefits, like they're going to wait till they're 70 years old or something to file, but you want those spouse benefits now, as long as that person is 62 years old, you can file. You file for retirement on your own account, work record. You have to do that. And then you file for spouse benefits on that person's work record. But that person's work record has to be over twice your amount. I just did a video on how to do spouse calculations. When was that? Yesterday? Day before yesterday? So make sure you watch that. I still have 200 different videos I have to do. So, and I get recommendations every day. People, oh, you had to do a video on this. So, yeah, for the next year, I'll be doing videos on trying to put together a resource for everybody to go to. Please click the thumbs up. Dr. Weir deserves it. Thank you, Donna. Appreciate it. Thank you for sharing your expertise. You're welcome. Thank you, thank you, thank you. Kathleen, thank you. Kathleen, I did things correctly. I think I messed up one time, Kathleen, or you're the one that called me on it. I pushed the wrong button and y'all were waiting there for an hour or so. So I think I fixed that problem. So even got a blue background and yeah, so I'm coming along, YouTuber. Let's see here. Kathleen, thanks for your information. You're welcome. Thank you, thank you, thank you. Okay, here's a question. How about I have Federal Blue Cross Shield retired? Do I sign up for Part B? Um, yeah, if you have FEHB, Federal Employee Health Benefits, some people do B, some people don't. So yeah, I would reach out to OPM. I know the post office makes you do it nowadays. Yeah, I would reach out to them and see if they mandate you. I think they do, but yeah, I don't want to. There's so many agencies out there. Good time. Hey, Dr. Ed, I'm on disability. How much of my benefits should my 11-year-old son be receiving? So yeah, if you're receiving disability, they get 50% of that, and so spouses get 50% as a disabled. Survivors, the children get 75%. But if I think you asked a question, I think a few days ago, you just have that one son, so there's no family max. So if you have like 3 kids, then there's a family max. So they wouldn't receive 50%. It would be however much the family max is divided by the 3 kids. But if you just have one, yeah, they'll receive 50% of your PIA, which is your primary insurance amount. So let's face this is IEDS question. Thank you. Trying to help my aunt with this. Yes. Thank you. Thank you. Thank you. That's what we need more of. Please, please, please. Your aunts, uncles, cousins. And I just did a video yesterday on, the one I did yesterday was on FICA. I'm trying to reach out to the young kids and, tell them about, oh, what's this FICA coming out? Because they need to start preparing, at least, knowing what all this is about. So yeah, Cindy, hi, just joining in. I'm so happy I caught you live. Yeah. Cindy, if you got any questions, just let me know. Let me get to some TikTok questions here. Is it true that there is a max $4,800 a month Social Security benefit you can get when you retire? Let me see here. Do I have the max number? I just did a video. I did a short little video on that, the max. I think it's about that. Yeah, I think it's close to that. I'm trying to think the 46, 45, 46. Yeah, that's if you maxed out your earnings for 35 years. So this year, the max you pay is $168,600. You pay FICA on that max amount. So if you did that for 35 years and you waited till you're 70 and you got the full delayed retirement credits, then yeah, it's about that amount. I thought I had it written down here somewhere, but yeah, I think you're correct. It's about that number. What paperwork is essential to submit to Social Security for autism disability claim for a minor? Um, Pretty much everything that um, gives that diagnosis. So when you file for disability, make sure you watch my 4 videos on filing for disability. All the tips, tricks, and secrets on that. Make sure you watch all those. But yeah, the diagnosis from a doctor, a specialist that specializes in that particular field, and you don't necessarily have to provide medical documentation. You can if you want to, but you give Social Security the doctor's name and everything, and you sign what's called an 827 SSA 827. Yeah, I still remember all the form names. It's going to go with me to my grave. And that gives them authorization to get the medical records directly. So they get the medical records directly from any clinic or facility or doctor or whatever. So you don't necessarily have to, provide anything if you don't want to. They get it. Um, but hopefully you've already filed, and you're not waiting for documentation. Please, please, please file, because the month you file is important, because the sooner you file, the sooner you can get a decision. And the problem is the decisions take forever. So you're going to be waiting. So please don't wait anymore. Please file for benefits immediately. I'm 62 and my husband is 74. He retired at 63. When should I start spousal benefits? Yesterday. Immediately, if not sooner. Run, do not walk, do not pass go. Go get your money. Because, okay, for spouse benefits. Okay, all right. So hopefully you've already started your own benefits. Okay, that's what I meant by immediately. Your own benefits, because if his benefit is higher than yours over twice yours, um, get your own benefits. Again, if you're working, you have to stay under the annual earnings limit. Was it 22? Yeah, $22,320 this year. And if you're under that, then get your own benefits. But in terms of spouse benefits, you can start those now, but they'll be reduced because you're not your full retirement age. So in terms of spouse benefit, in terms of your own benefits, hopefully you've already started those. Please, please, please get those started immediately. But in terms of spouse benefits, when you file for your own, you can kick around the numbers and say, okay, how much more can I get for spouse benefits? If I wait till next year, how much more is that going to be? If I wait until my full retirement age, how much more is that going to be? And that, when you receive your spouse benefits, does not affect your survivor benefits. So when a spouse passes away, it's how old the spouse is at that time that will determine the survivor benefits, not when they took their retirement or spouse benefits before. So that's another calculation you have to kind of figure out. But if you're 62, please, please, please immediately sign up for benefits on your own record. Again, if you're under your earnings limit, all that kind of stuff. So was accepted for SSDI, but it takes a while. Can I get Social Security for a year? Okay, yeah, I think I already answered that one. Let's see here. I didn't take drug coverage at signing up for Medicare and now be penalized. Why? I'm not on meds. There you go. That's exactly, I hear all the time. But it's insurance, just like car insurance. I don't intend on having a car wreck this month. Why do I have to pay auto insurance? because that's the nature of auto insurance. The people, health insurance, all of it, the people that are, healthy, they're paying the premiums, and that pays for the people that are sick. And eventually when you get sick, all the people that are healthy are paying you. So yeah, that's just the nature of the beast. So yeah, um, I wish somebody would have kind of explained that to you so you would have avoided that penalty. But now you know. So immediately, as soon as you're able to sign up for Part D, which probably won't be until October, then you can sign up for Part D, and your Part D will start in January. But yes, you're going to be penalized for the rest of your life. Yeah. Um, yeah, there's just Medicare agents and brokers aren't doing their job out there. So that's why I decided to put together my own network. Advice for disability. Yeah, advice for disability. Number one is watch my 4 videos on disability. I've laid it all out there, tips, tricks, and secrets from, I've taken hundreds of thousands of disability claims. So all of the, kind of tips I've put in those 4 videos. How does and those are all my on my YouTube channel. How does spousal benefits work? I'm 62, husband is 70. Oh, okay, yeah. So, yeah, and you said your Social Security is less than half of it. I just did a video on spouse benefits on the calculations a couple of days ago, but yeah, basically, if his is twice the amount as yours, then you get the difference minus your own. You have to file for benefits on your own record. So that's why I say immediately get those benefits, because once you file on spouse benefits now or next year or 2 years from now, your benefit is still going to be the same. Yours is going to get more or less from him. So it all washes out the same. Um, so that's why you should really start your benefits immediately. Can you be a caregiver for a family member with Medicare? Absolutely. Whether they pay you, that's a whole different issue. Can they take your house if it's in a regular trust? Yeah, it has to be an irrevocable trust. I'm not a lawyer. I don't play one on TV, but that's my understanding. That's what I've been told by every lawyer I know. Do I have to sign up for Medicare at 65? I'm 64, but may not retire until 67. No, no. If you have health insurance from your current work and you're happy with it and it doesn't cost you an arm and a leg, and your employer, your group health plan has to have 20 or more employees. And if all that's the case, then nope, you don't have to sign up for Medicare at all. If you're already receiving Social Security benefits, then Medicare will send your packet automatically, and you just return it and say thanks, but no thanks. If you're not receiving Social Security, then you don't have to do anything. You don't have to call Social Security or Medicare at 65 and say, no, I don't want it. You don't have to do anything. You just, once you stop working and you stop receiving health insurance from work, then again, you technically have 8 months, but about a month or two before you're going to stop working and stop receiving that health insurance, then you'll need a couple of forms, 40B and a 564. And I've got a website on that. So just reach out at that time. And yeah, then you just sign up for Part B, and there's no penalties whatsoever. Sign up for Part A and Part B at that time. I took my deceased husband's Social Security at 60. Should I have waited? Yeah, it's yeah. A lot of people take it at 60. That's the earliest, and then so you're taking survivor benefits now, and when you get 62, you can check your benefits on your own record and see how much they are. Here's my recommendation: even if the benefits on your own record are more, it's $100 more, $200 more, whatever the case may be. If you don't necessarily need that extra money now, I would wait. Stay on survivor benefits and just let your benefits increase, because your benefits will increase every single month, and then if you wait till your full retirement age, 66 in 10 months or 67 or whatever, then at that time you jump from survivor benefits over onto your own and you made a whole lot more money. Or if you wait till 70, then you make it 24% more. So your benefits max out at 70. So yeah, you stay on survivors, and then check every year and say, hey, how much is my money now? Okay, this month. Oh, okay, I'll call you next year. Hey, how much of my money? Oh, okay, all right. I need that extra $400 a month. let's schedule an appointment and do it to it. Yep. If you have 40 credits and work part-time, how does this affect your Social Security? Um, so if you have 40, so Social Security defines, or excuse me, calculates your benefits by your high 35 years of earnings. So if you have your 10 years, 40 credits, that's fine. That means you're insured. But if that's all you have, then yeah, your benefit amount is not going to be very much because you have 10 years of earnings and 25 years of zeros. So you want to, pay into that FICA as long as you can, replace those zeros with actual numbers. And that way, in the future, when you file for retirement or, your spouse filed for survivor benefits or spouse benefits or disability, then your benefit amount will be higher. So, all right, it is an hour and 20 minutes. Good time. Thank you very much for the donation support, Don Ricky. $1.99 from Good Time. Thank you very much, Ricky. $5. Thank you for answering everybody's question. You're welcome. Thank you. I've got my coffee IV for the day. I sure do appreciate it. Thank you. Thank you. Thank you. All right, I think that'll do it for today, and let's do it again tomorrow. About the same bat time, same bat channel. We'll see you then. You all have an awesome night. Take